surgical retina is a subspecialty in ophthalmology. We work with like the medical part. Medical retina is we um, work on conditions and educate patients about their retinal conditions. There are genetic, some acquired, toxicities, and hereditary conditions like macular degeneration, diabetic retinopathy. So there's a lot of conditions that can affect our vision and quality of life for patients. So a retina specialist would be the person who would describe and explain to patient what they have, what can we do, all the treatment options. Especially with nowadays, we have a lot of advancements in medical treatment, surgical treatment. So we will go over those things and help patient to decide which one fits better because even if it's the same condition, sometimes it doesn't fit the mold. Patient has some additional systemic disease or something else that we need to address before we even address the retinal problem. And surgery-wise, one of the most common surgeries for retina is retinal detachment, macular holes, retinal membranes. Those are all done. Most like in the OR, retinal surgeries are done through vitrectomy or scleral buckling. So it's very technical, step-by-step surgery, which I also like that it's organized. Um, so it's going inside the eye, removing the gel of the eye, and working on a problem that is inside, whether it's a macular hole or peeling a membrane or fixing the retinal detachment. Sometimes working with a lot of scar tissue or bleeding inside the eye that we try to remove, following which we, depending on the complexity of the case, you can leave it with normal fluid in the eye, put a gas in the eye. There are two different gases, and or heavier material like silicone oil. So we discuss all the options, and this is, I guess, where it is important to kind of get to know your patient better and ask what their plans are because there are several restrictions. Like if the patient has a gas, you cannot fly, but you can have an oil and maybe be able to fly if it is absolute necessity.